So for your test, the rhythms that you are going to have to be familiar with are as follows: atrial fib, atrial flutter, V-fib, V-tach, pacemaker, sinus rhythm, sinus bradycardia, and sinus tachycardia. So here is a diagram of a complex or the electrical activity of the heart. As you see, there is a P wave. It falls in front of the QRS, which is right before the T wave. So whenever you're looking at your waveform or your complex, know that the atrial contraction is the P wave up until the Q. Then the ventricular contraction starts at the R wave all the way through to the T wave. So just keep that in mind when you're looking at your rhythms and what's falling where. It will help you in determining sometimes your complexes. So we're going to first begin with sinus rhythm. Starting off with interpretation, we want to look and see if our R to R waveforms are consistent, meaning are they the same distance apart each time? When we look at this rhythm, we see that it is. So we're going to consider that regular. Next, we're going to look at the rate. And the rate is determined by the number of R waves. You are going to be given a 6-second strip. You will count the number of R waves and multiply that by 10, and that will give you the heart rate. Next, you want to see if there is a P wave in front of every QRS. If there is, yes. So you put all of these factors together and you have normal sinus rhythm. We have a regular rate. The rate falls between 60 and 100. There's a P wave before every complex. We're going to call this normal sinus rhythm. So now we're going to look at sinus tachycardia. And essentially, you're going to interpret it the same way as you did sinus rhythm. So once again, we're going to look and see if our R waves are consistent, meaning are they regular? According to the diagram we have, they are. Now you're going to count the number of R waves present. As you see, there's roughly 13. You could count the very last one as 14. That's fine. It really doesn't make a difference for this particular strip. Next, you're going to look and see, is there a P wave in front of every QRS? Well, yes, there is. So that puts it in the normal category. So regular rhythm, heart rate, 130, which falls between the 100 and 160, that determines sinus tachycardia. You have a P wave as well. So you're going to interpret this rhythm as sinus tachycardia. Now, some of the causes for sinus tachycardia can be exercise, anxiety, caffeine, nicotine, fever, shock, congestive heart failure, hypotension, pain, hypoxemia, and MI. So we're going to move on to bradycardia, specifically sinus bradycardia. You're going to interpret this the same way you've done the two previous rhythm strips. You're going to look and see what the relationship between the R waves are, meaning is it the same distance between each R wave? Yes, it is. So it's regular. Next, you're going to look at the rate. You see that there are 5 R waves. 5 times 10 is 50. So you know anything below 60 is bradycardic. Next, you're going to look and see what the P wave looks like. Is there a P wave before each QRS? Yes, there is. This rhythm is now interpreted as sinus bradycardia. Causes of sinus bradycardia can be damage of the SA node, which we know is the pacemaker of the heart, right? Some people can have this normally, like athletes. It can be a vagal response. It can be attributed to glaucoma, hypothermia, inferior MI, certain drugs, and increased intracranial pressure. So now we're going to move on to atrial flutter. So with atrial flutter, you're going to use the same interpretation methods. You're going to look to see if the R to Rs are regular. Is it consistent? In this case, it is. Occasionally, you may have an irregular R to R complex noted, but with this particular strip, it is regular. So how many R waves do you have? Well, there are 8 R waves in the 6-second strip. So we multiply the 8 by 10 and we get a heart rate of 80. Is there a P wave before every QRS? No, there's not. What you see between each complex there is a sawtooth pattern or a flutter wave. That is not a P wave. So that is one of the telltale or hallmark signs of atrial flutter, is that sawtooth or flutter wave pattern. So the rhythm is regular. There is no P wave. There is presence of a sawtooth pattern. We now have atrial flutter. Causes of atrial flutter can be ischemic heart disease, MI, digitoxicity, mitral tricuspid valve disease, stress, PE, we're talking about pulmonary embolism, hyperthyroid, and sometimes a temperature. So now we're going to look at atrial fibrillation, and you're going to interpret it using the same steps as before. We're going to look and see what our R to R looks like. So in this case, the R to R is irregular. In atrial fib, the R to R is always irregular. You see that the distance between the R waves is not consistent. That makes it irregular. We're going to next look at our rate. As you see, there are 5 R complexes. So 5 times 10 is 50. That's your heart rate. Next, is there a P wave? Now, I know you see a lot of little squiggly lines in there, a lot of bumpy things in there, but none of those are a P wave. I see in front of the QRS complex with the second rhythm there, the second R complex, there might be a P wave there, but it is not consistent with the findings of the other QRS complexes. They do not have a P wave in front of them. So this is where the atria is kind of chaotically firing. It's not being consistent. It's just kind of quivering, you might as well say, there and not forming a complex, the P wave. So there's no P wave present. So we have an irregular rhythm with no P wave. We have a rate of 50. So our rhythm is now interpreted as atrial fib or atrial fibrillation. So now we're going to talk about ventricular tachycardia, or VTach. With this rhythm strip, the rhythm is regular, meaning that their distance between the R waves are consistent. Occasionally, you will have irregularity noted in your VTach. The rate is 150. There is no P wave before the QRS complexes. The QRS complex is wide and bizarre. This is ventricular tachycardia. Now, once you diagnose your VTach, you want to see if your patient has a pulse, yes or no. That's going to determine your treatment. If there's a pulse present, you're going to give them some medication, hopefully before their condition deteriorates. If the patient becomes worse and unstable, you're going to then defibrillate the patient with VTach. VTach is a lethal rhythm. So let's take a look at ventricular fibrillation. Ventricular fibrillation is a lethal rhythm. As you see, there is no R to R. You're unable to determine a rate. There's no P wave, there's no QRS. The baseline, as we call it, is chaotic and wavy. You have ventricular fibrillation. You must defibrillate the patient immediately. So now we're going to talk about agonal or an asystole rhythm. With these particular rhythms, they're also known as a dying heart. There is no R to R. There is no rate. There's no P wave nor QRS. Essentially, there is no pulse with this patient. So your patient does not have a pulse. You should be doing CPR, or they should be ending the code situation. A pacemaker rhythm is often characterized by a spike before the QRS. This will help you identify this rhythm. Thank you for joining me today in our discussion with cardiac arrhythmias. Feel free to contact me with any questions or any additional information you may need to understand interpreting cardiac rhythms. Thank